And welcome back to All Business Media TV. I'm your host, Rick Delgado, and welcoming back into the studio is Dr. Christine Silverstein. She's the director at the Summit Center for Ideal Performance out of Oakland, New Jersey. You can reach out to her either by phone at 201-760-1600 or her website. She's got two of them, fertilebodyhypnosis.com or idealperformance.net. Dr. Christine, welcome back, and how are you?
I am doing very well, thank you.
All right, well, thank you for taking the time.
I'm very excited to be back.
Great.
And to have this interview today.
Great. And we've done a series of these so far.
Yes.
Before we jump into that, though, Dr. Christine, for anybody who's joining us, maybe seeing you for the first time and not really, knows who you are, tell everybody a little bit about yourself and what you do as a director at the Summit Center for Ideal Performance.
I'm a peak performance coach, a registered nurse, and I specialize in behavioral modification, and I'm also a clinical hypnotherapist. And I work with many clients of all ages to help them reach their peak performances in areas of health and wellness that we're going to talk about today.
Right.
And also to win championships in athletics. I work with performing artists and people in business, and I help students in their educational requirements.
All right. Well, there doesn't seem to be any lack of somebody you won't help, right?
Right. I'm very open to working with everyone, of course.
All right. Well, that's great to hear. Now, we're in the midst of doing a series of 6 of these.
Yes.
This is number 5 in our series. So what did we cover in part 4?
Well, the last interview was about my program Metamorphosis, Fertility Enhancement Coaching. And we talked about how you can use the power of your mind to become pregnant.
Right.
Rather than taking IVF as a first option, you can use natural approaches.
Right.
And also we talked about the biopsychosocial aspects of fertility, which at times is not discussed. It's just the physiological or the biological aspects.
Right.
So we talked about other things beyond that. And we discussed the 6 stages of the fertile body method, and I gave some case studies showing how I use it with my clients.
All right. And now we're going to be talking about this program, Operation Heal, correct?
Yes.
Can you talk a little bit about that program?
Yes, it's a very unique program that I developed many years ago, and I'll speak about how it came about.
Okay.
But it is a perioperative program that works with clients who have upcoming surgery or procedures, treatments, and I also work with those who have health issues, longer-term health issues, to help them to improve wellness.
Okay.
And the program was created and designed to have an environment that can promote healing, rapid healing, and wellness, and it's used oftentimes without the use of any drugs. Now, the word perioperative, you might be wondering what that word means.
I don't even know how to spell it.
Right? Well, it means before, during, and after surgery.
Okay.
A lot of OR nurses refer to themselves as perioperative nurses. And you'll notice also that in the word health is the word heal. So Operation Heal is a wellness program designed to augment medical care that you might receive from a physician or stand alone in cases of health maintenance and self-healing.
All right. Now, why is a program like Operation Heal, why is something like that necessary, Dr. Christine?
Well, we know that healing is natural. It's innate to all of us, right? So we can heal from a cut finger,
right,
naturally. And we can also, if we should have bleeding or hemorrhage, we can use the power of the mind to stop the bleeding. And we also know things like you can move into a situation where you have an illness and you don't know what to do to help yourself to heal. So you can use the power of your mind. And I'm going to give you some experiences that I've had where I used the power of my mind and tell you how you can improve. You were just talking about how you injured your arm lifting weights. So it's very important to look at these things because very often only the physical is focused on.
Right.
And we have different aspects about a physical body, but we also have the mind, the spirit, and the fourth level of healing is also looking at emotions.
Now, what about fear? Because you mentioned emotions and stuff like that. I'm sure fear gets in the way, right?
Yes. Well, fear can really interfere with any healing, or it can create delayed healing.
Right.
And we know that you may be so physically tense that you're not getting circulation, say, to the operative site.
Right.
And you might go into that HPA axis that we've been talking about that starts in the brain in response to stress. And you may have excess cortisol, which really compromises the immune system.
Right.
And also, if you're tense and you're using rapid breathing and shallow breathing, you may not get the oxygenation that your body needs to heal.
Okay.
So it's very important to prevent being stressed out or fearful so that you can promote healing.
Right. And you're talking also about post-operative, right?
Yes.
Now, can you give an example of how fear has maybe interfered in surgery?
Yes, I actually can. I can give you a personal example
okay.
of what happened to me many years ago. And it started with this idea that we've talked about in the past, that I had 4 miscarriages and then 4 live births.
Right.
Well, my fear started with the birthing process because I had 4 cesarean sections.
Right.
I had very large babies, up to 10.5 pounds.
Holy moly.
And I
Really?
am a petite person, yes.
Wow.
And so that created challenges for me. So having the 4 cesarean sections was one thing, but what really made me fearful was having the surgery without the effective use of spinal anesthesia.
Right.
The anesthesia was ineffective at numbing pain sensation. So I had, for these 4 surgeries, pain throughout the entire operation from beginning to end. And so after the first cesarean section, I looked around for people to help me. And I knew that there was something I could do, but I couldn't find a clinician or hypnotherapist or anyone really to help me.
Right.
So I decided to, of course, change hospitals, change doctors, change anesthesiologists. And I told the doctors and the anesthesiologists what had happened, and they said, "Oh, don't worry, this time it will be different."
Right.
But it wasn't different. I had 4 cesarean sections with these challenges each time. And it's a rare occurrence from what I'm told, maybe I'm in the 1 to 4 percentile
Wow.
of having this challenge.
So now,
But
what did you do to help yourself?
Well, I did not choose to have any general anesthesia
Right.
and drugs because there can be complications from using drugs and general anesthesia.
Right.
So before my first cesarean section, I had this fear after I was in labor for many hours. I was in labor for 24 hours, and the doctor told me, "You need to have a C-section," and I was fearful of that. And during the surgery, from the very beginning, I started to feel increased pain, and I told the doctor and the anesthesiologist, and the anesthesiologist said, "That's impossible that you're feeling pain because it's so rare."
Right.
So the doctor gave me a mild dose of Demerol, and that didn't work. And then he offered me morphine, and I rejected that because it crosses the placental barrier, and I didn't want the baby to be affected
Right.
with a decrease in oxygen. So I just rejected it, and I got through the surgery, gritting my teeth. And I tried to heal afterwards, and this is my first child, and I had had 3 miscarriages, so I was very happy to have the baby in my arms. And so I just healed physically from it within a short period of time.
So now, what happened with the subsequent births? Because like you mentioned, you didn't just have 1 kid; you had 4.
That's right. That's right. Well, during the second cesarean section, I attempted to have the baby without the C-section, to have it vaginally.
Right.
But the baby was larger, even larger than the first one.
Wow.
So on the operating table, I just remember being in great pain. The doctor said he was tugging on my ovaries or something at the other end, but I felt severe chest pain,
Right.
and I felt like I couldn't breathe. And meantime, there was a pediatrician present because when you have a cesarean section, he's there for the baby, for the newborn. So he yelled out, "This is barbaric. Just give her something." Right? So I gritted my teeth once again, and I got through the surgery without taking these drugs for the health of my babies. And then I healed, pretty rapidly afterwards with a minor incision. My incision opened up a little bit, but I was able to heal within a short period of time.
Right.
But then I was back for a third cesarean section
So
within 3 years.
So now, talk about the third cesarean. What happened with the third C-section?
Well, the third one was the most challenging.
Okay.
And it was the most challenging post-operative recovery as well. And the reason for that, I believe now looking back, is I chose, instead of having spinal anesthesia, which hadn't worked, I asked if I could have an epidural that women use all the time to give birth.
I've heard of it.
Right?
I've seen it in movies. They come with the big needle and everything, right?
So, yes. Well, so anyway, the anesthesiologist said that he wasn't really that adept with giving this and that it was more challenging to administer. But he followed my request. And right from the very beginning, I felt severe pain. Like burning hot coals were placed in my abdomen. And I had my arms tied down with boards because you have an IV and then you have also blood pressure cuff. And I felt like I was literally being crucified.
Right.
And my husband was sitting on my left side and he was in the scrub suit. And I grabbed his shirt and I was screaming and I remember pulling out his chest hair, during that. Because he didn't know what to do. He was terrified. And then afterwards, when I finished the surgery, they tried to push down on my abdomen, and it was so painful that 3 people had to hold me down because they were checking the fundus of the uterus.
Right.
And so post-operatively, I recovered, but it was very challenging, and it was prolonged postpartum period.
Right. Now, what about the post-op recovery? The baby's out. Now you're in your room, right?
That's right.
How is that portion of it?
Well, from the very beginning, and for years, a year later, I had numbness from the waist down.
Wow.
And it felt like I was walking on shards of glass under the soles of my feet. And so I went to a health club, tried to exercise. I went to chiropractor. I went to many physicians trying to find out what the problem was. And they gave me vitamin B12 shots. And they gave me prescriptions for tranquilizers. And none of these things helped me, right? I even went to acupuncturist and without success. And it wasn't until I actually met up with the wonderful biofeedback hypnotherapist, and he helped me with self-hypnosis to heal my body, mind, and spirit. And gradually, I was able to really take care of my children, and I had 3 children now, 5, 3, and a newborn. And on top of that, I packed up my house. I sold my house. I moved to a larger house during the first 5 months of my daughter's life.
Right.
And it was really stressful for the baby. I know that she was very tense. She had bilirubin challenges and all kinds of challenges as a result of all the stress. And eventually I got feeling back in my legs.
Well, that's good.
But I was healed physically, but not emotionally.
Right.
And in 3 years' time, I was back with the 4th baby.
Right. And now, how did you heal from that trauma, though?
Well, it was very challenging. Years later, I was a hypnotherapist, and I took a course on using hypnotherapy for pain management. And during the lunch break, it was given by a nurse anesthetist who had been in the Navy for many years. And he said during the lunch break, you can stay in the classroom and you can watch a video of someone receiving hypnotherapy during surgery. So I thought this was a good idea. I had my lunch, salad and some yogurt.
Yeah, it's like a little movie.
That's right. And so I'm watching the video, and all of a sudden I see a woman being wheeled into the operating room on a stretcher, and she's having abdominal surgery. And with that, I went into a total panic attack right there in the classroom. I almost choked on the yogurt, and I ran out of the room into the parking lot. and it was raining, and I was crying and very upset, and I couldn't breathe.
Right.
So I came back into the classroom, and I told the instructor what had happened, and he said, "Oh my gosh, I've heard of cases like this." So he took me out into the hallway, into a quiet space, and he used a hypnotic technique to help me in the moment and also to get through the rest of the class in the afternoon.
Mm-hmm.
And then later on, he worked with me for about an hour after class, and I'm so grateful for this. And he used more hypnotic mind-body techniques, and I cried a river of tears. I just cried and cried and cried.
Right.
And by the end, I knew that I had healed on all 4 levels of healing: body, mind, spirit, and emotion.
Wow. So now, once that happens, does that open your eyes to say, okay, now look at what this has done for me? Now, is that what kind of got you going in this direction?
That's right. That's right. So I got to heal from that trauma. At first, I thought I was healed
Right.
with the others, but it was only physical. So I have here
Yeah, I was
this
going to ask
little
about
crystal, right? This is from Tiffany's,
Okay.
and it was made for
Oh.
another purpose, right? But if you look at it, and I showed you before, if you look at it, you can see the 4 circles,
Yeah.
and there's a triangle here,
Mm-hmm.
and it's body, mind, spirit, and then inside
Right.
is the emotion, right? That you have
Okay.
to really work with to totally heal
Right.
on all 4 levels.
So now, what is that used for?
Well, we're going to talk about how we heal on all 4 levels, right? Because
Okay.
I had to learn this, perhaps had to have this experience, so I could be grateful for the care that I got from these wonderful hypnotherapists. But also, I learned from the numbness how to help my dad walk, right? We
Oh,
talked
that's
about
right, I remember that.
When he was numb and he thought he was paralyzed. And also, I learned from this experience of the emotional trauma how to work with a 9-year-old girl who healed physically from surgery, but
Right.
not emotionally. And so she was a little girl who was really on the brink of dying from dehydration
Mm-hmm.
and starvation. And I presented this case at the Milton H. Erickson Brief Therapy Conference in Orlando, Florida in 2010.
Yeah, you mentioned that. And now, what was that girl's situation?
Well, she was 8 years old,
Mhm.
and she played a game of soccer and scored 2 goals,
Which is good.
which is good. And her father was the coach of the team.
Okay.
And then that morning before the game, she had a stomach ache, and she thought it was just an upset stomach. But after the end of the game, she was really in a lot of pain.
Right.
So they brought her to the emergency room, and she had an emergency appendectomy.
Oh, wow.
And she recovered physically from it,
Mhm.
but not emotionally. And so what happened was the surgeon and the pediatrician said she should have healed.
Right.
We don't know what's wrong. But then when she didn't eat or drink,
Mm-hmm.
the doctors said, well, you have to go to an anorexia facility for teens. That was 3 hours away.
Right.
Now, this little girl wouldn't be able to attend school at this facility because she was only 9 years old. They didn't have education on her grade level, so she was devastated
Right.
and alone.
So now, what was her situation at home?
Well, the idea was that her mom first called me, right?
Okay.
And she was desperate on the phone, saying, could you help my daughter? You know, I don't know what to do. And she was crying. And she told me the story of what had happened with her daughter. And she had to feed her
Right.
with a nasogastric
Mm-hmm.
tube. So when she came to my office the very first time, the little girl was so scared, she was clinging to her mother.
Right.
And she had sunken eyes, and she had also this circles around her eyes, and she was very frail.
Mm-hmm.
And the NG tube had fallen out the day before, and she didn't want it put back in. The little
Right.
girl didn't want it put back in. So she had, as a result of this, she had cardiac arrhythmia and also electrolyte imbalance because she wasn't eating and drinking. And then, so her mom said, can you work with her to have hypnotherapy? I don't know what to do.
Right.
The doctor gave her appetite stimulants, you know, and that was it. So I didn't know how I would work with her
Mm-hmm.
because it was a situation that was not very common, but I prayed and I knew I would get inspiration.
Right.
So then I said yes, and we began working immediately.
Okay. So when you start working together and you met her for the first time, what did you see?
Well, I saw this little girl who wouldn't eat and drink.
Mm-hmm.
She blamed herself for this appendectomy because she thought it was something that she ate, and that's why she wouldn't eat. So then when the NG tube fell out, she was able to drink this liquid supplement called Ensure, but it took so long for her to drink it. So for 8 ounces, it took her 8 hours, and
Right.
she would drink it in isolation away from her family. So this wasn't enough nutrition for her to go to school.
Mm-hmm.
And she was starting now to communicate with other teens who had anorexia,
Right.
and she was starting to align with them. And I knew that we had to change direction because she would become one of them.
Right.
And so that's where the story began.
So
Okay,
now-
so what do you do?
Yeah. What are your goals when you're working with this girl and someone like this who's got this kind of issue?
That's right.
The goals that you kind of work toward.
It was a serious condition, Rick, because with the electrolyte imbalance in the cardiac arrhythmia, her life was threatened.
Right.
So her goal was to attend school, the 4th grade. There was a new school opening up in town, and she really wanted to be with her friends, and she
Right.
wanted to return to the soccer field. So because the NG tube fell out, she didn't want to put back in, and we joked. We said, well, if you have your class picture, it would be better, not to have this tube hanging out of your nose, right? So it happened to be in the summer, and the Summer Olympics were going on.
Right.
So I helped her to develop this goal chart where she could make her drink faster and drink more supplement, and also to play in the backyard Olympic games with her sisters and brother.
Right.
And they won gold medals and silver medals and bronze medals playing these Olympic games. And so gradually she was able to eat more, drink more, so that the doctor said she could go to school.
Right.
And so that was really a challenge for her because at first, when she first came to me, she was totally nonverbal.
Right.
And I had to figure out a way to communicate with her, right? So I know I had to reach the subconscious mind where all healing takes place. But she didn't say a word. Right?
It's tough to get there if she's not going
Yes.
to talk.
So I'm thinking, okay, so what do I do?
Right.
So I came up with this idea.
Okay.
Now I know
Oh,
what
here
you're
we
going to
go.
tell me, right? Because the last time we had a picture of a bird's nest, and remember the little blue robin eggs.
Yes.
So now the eggs have returned. They've hatched,
They've
right?
hatched,
They've
haven't they?
hatched
Look at
here.
this. Look at this.
Right.
Now we've got hatchlings. We've got hatchlings.
And
right
so
here.
I use this little hand puppet to
That's a
communicate.
hand puppet. They
That's
look
right.
real, Dr. Christine.
That's right.
I don't think that's a hand puppet.
It's a little
Don't mess
hand
with my
puppet.
head like that.
So the little birdies, they're so happy to be on TV the second time
Well,
around.
yeah.
The first time in the little portrait, and now they're happy to meet you. So
Well,
I'd like
nice
to
meet
introduce you.
What are their names? Do
Well,
they have names?
Yes, of course.
Okay.
Okay, over here,
They have names.
she's waving at you.
Yes.
Her name is Felicia.
Hi, Felicia. Ooh,
Felicia
that's a
first-
sexy name.
Felicia First Brainer, right? And
First Bra-
she's
First
First
Brainer?
Brainer.
Okay.
And she's associated with the conscious mind, or the ego, if you're looking at it in Freudian terms,
Okay.
right? And then over here, she's waving.
The
This
one
is Samantha.
On your right, my left.
That's right,
Yep.
Samantha. She's waving. She's Samantha's second brainer, and
Okay.
she's connected with the subconscious mind, or the id.
All right.
And
Now,
in
what
the
about
middle-
What about the middle?
In the middle is Nellie No Brainer, right?
Ah,
And she's the referee. So I used this little hand puppet, and I played birds chirping in the background. And we had kind of a conversation between the three birds. So Felicia might say, remember this is the conscious mind speaking,
okay.
and she might say, don't eat that food. That food will make you sick again. It's bad for you. And then Samantha, connected to the second brain that's in the abdomen, she said, but please, I'm so hungry. Feed me, I'm hungry and I'm thirsty. And Felicia said, no, you'll vomit again. And then Nellie No-Brainer, the referee, she chirps in, this is ridiculous. This is a no-brainer to eat food. You have to eat this delicious food to be healthy and happy, right? So we had this whole conversation, and I recorded it so that she could listen to it daily.
And did she respond? Like, did she talk back to the birds, or was it just all you, Dr.
It was, at first, it was all me, because remember, she was nonverbal.
Right.
Right. And then, so gradually, with these things, she was able to have more supplement and to drink it faster. And she was able to go to school. And she was so excited to be in the cafeteria with her friends. And the first time she ate a peanut butter and jelly sandwich, she reported it, and she was so proud of herself, right?
Well, that's awesome. And that's great, especially for a kid that young.
That's
you know,
right.
that's a tough time. You go into school and have issues and not be able to, eat lunch. One of the things that everybody does, eat lunch with your friends.
Yes, well, she wasn't able to eat anything at all. Remember, she wasn't eating or drinking.
Right.
So
to be able to get
to that point and to get through the class, etc.
Yeah.
And so it was monumental.
Definitely. Again, we're talking with our guest, Dr. Christine Silverstein. She's the director at the Summit Center for Ideal Performance with Little Birdies. You can reach out to her directly either through the websites, fertilebodyhypnosis.com or idealperformance.net. You can also give her a call directly at 201-760-1600. And again, Dr. Christine, we appreciate you joining us. And of course, this is an example of, I guess, imagery, right?
Yes.
Using imagery. Now,
that's right.
What else do you use for imagery to help your patients?
Well, I have some things here. I'm going to show you.
Oh, what do we got? We got
what
more,
I used.
We got more stuff in the bag.
Yes, for this little girl. I used this story here. It's called Stone Soup.
Okay.
And it's about these soldiers who came back from war, and they went to a small town, and they wanted something to eat and lodging, but nobody would help them out.
Right.
So they came up with this idea that they would take some stones, and they would tell the people in the town that they were going to make soup, stone soup.
Right.
And they went back around to the people in the community, and everybody started to contribute to the soup pot. And then at the end, they had a big celebration. Everybody was so happy, and they got some great lodging out of it.
Okay.
So what I did with this young girl, here's another picture.
Okay.
We have here the Stone Soup book. So we would play gourmet chefs, right? So I had a big soup pot, and I had a pumpkin candle underneath the table to heat it up. And we're using our imaginations. This squash and carrots and onions, celery, and we put some water, and of course we have the stones here. And this stone is heart-shaped.
Okay.
And so we added all these things, and we played in our minds, and we also looked up recipes that she could bring home with her to her siblings, and they made meals, and she began to eat more and more.
Just from playing with stone soup.
Stone soup. That's exactly. And talking about food, and starting to talk about, well, which foods will you eat this week?
Right.
To add to your recipe.
Right. All right. So it was a way to kind of break down that barrier.
That's right, and to start her on the road to recovery.
Now, what about? What do I see here? Is there a little bird red or something?
Yes.
What do you got?
we have
She's got more wonderful toys.
We have other things. Yes. So so we also work with soccer imagery. Right.
Okay.
She was a soccer player, and
Right.
she loved Mia Hamm, who was very famous at that
Right.
time. And we watched a little video of Mia Hamm with her children in the kitchen eating, and how important nutrition was. And I also used soccer imagery so that she could imagine that all the trauma, all the pain, all the anger was in the soccer ball. So in her mind, we would go to the soccer field and kick that soccer ball right into the net and score and score and score to release all the trauma. And another thing that I used was this story here called The Little Red Bird.
Okay.
And so that's why we have this little red.
Is that why this is here?
That's right.
Okay. So the book wasn't enough. You brought an actual cage with the red bird sticking.
Yes. Yes, because I'm going to tell you the story.
Okay.
So this is about a little red bird who was in the cage, and she had everything to eat and drink and to read. Very content.
Right.
But one day, the cage door was open, and it was facing an open window of the room. And she had the opportunity, if she wanted, to fly outside for the very first time. So then she said, oh, look at that. I think those things are called trees, you know, and then people. And then after she flew out, she was playing with the children in the park and had a wonderful adventure. But at the end of the day, it was getting dark, and she asked this question, should I stay or should I go back to home? What would you do?
Well, you know, especially if it's getting dark and I'm hungry, I'm going home. I got to eat.
Okay, so she took another route eventually, right? So after about 6 months' time of working together, she was able to go to a nutritionist who gave her a healthy diet to eat.
Right.
And that was impossible before that because she wasn't eating anything.
Right.
So with that, she was able to get through that school year. She won a spelling bee. She was class leader. She got all A's on her report card. And she was ecstatic that she was able to go to the 4th grade and go back to be on the soccer team.
Right.
And along with that, we never found out the exact cause, but it was related to trauma. And this trauma was so deep, as I said, the 4 levels of healing. When you talk about emotion, and that sinks really deep down, like it had with me with the Cesarean sections.
Right. So now, how is she doing now?
Well, I kept in touch with her over the years. I would send her little gifts from around the world, pretending I was a little red bird. And then when she graduated from high school last year, I sent her a card and also a little note. And she was so happy to hear from me because we talked about the experience she had. She remembered all the imagery. She was so glad that I worked with her when no one else could or would.
Right.
And she knew from the very first meeting that she would be healed. And she was a happy, healthy young woman going off to college. This was 9 years after we had worked together. She's now 18. And she was studying psychology and nutrition so she could help children in her situation.
Oh, wow.
So it's a beautiful story. So she healed on all 4 levels, body, mind, spirit, and emotionally.
And again, she came to you nonverbal.
That's right.
And now she's, you know, going to college and looks like she wants to help people do kind of basically what you did for her. That's great.
Yes.
Now, can you give us any other examples of how imagery has helped with
Yes.
people that you worked with?
Yes, I can. Actually, it's an example that I had with my husband.
Did you use the birds on them?
No, I didn't use the birds, but I'll show you what else I did use in a moment.
All right, this can get a little racy now.
Well, the story is that we were on our way to the movie theater to see Nobody's Fool.
Okay.
And my husband slipped on an icy sidewalk. He fell down and broke his leg. It was a compound fracture in 3 places. Right? So he's sitting on this icy cold dark sidewalk across the street from the movie theater. And he said, I think my leg broke. And I looked, and the bone was sticking not only through his skin, but through his clothing. And he was bleeding on the sidewalk.
Right.
Right? So the police officer came, and he said to my husband, let me straighten out your tangled leg, right? And I said, no, wait. Wait until it's splintered, because you can injure the tissue, but also introduce bacteria.
Right.
So he was arguing with me, but finally I convinced him. I'm a medical surgical nurse, and I knew I was right.
Right.
So then he went to the emergency room, and the x-ray showed he had extensive breakages, and his leg was so limp, it was hanging off the table like this, because there was no bone structure.
Right. So now, how did you assist him in healing?
Well, I knew that he was really very anxious about this whole thing. So he was in the hospital for several days, and he had PT, so he could walk with crutches.
Right.
But he went back to work. No, he didn't go back to work initially. He was out of work for 6 weeks. And he came home with a lot of pain, and he also had this drainage coming from his wound, and he didn't know what to do. So I made him an audio tape, a therapeutic audio tape, and I put imagery on it to help promote healing and to stop the drainage and bleeding, and also to limit the amount of drugs that he had to take.
Right.
So he basically just took antibiotic and maybe some Tylenol once in a while. So he really was successful with that. And the bone started to heal. And he was very happy. And actually he got an award that year, the next year, for his engineering that he did while he was home. And we went to the Plaza Hotel and had a great weekend, right? So that was the benefit of breaking his leg, although he had many challenges and difficulties with the healing of the leg.
Right. Now, what were some of those difficulties in the healing? Because, you know, for it to take that long, that's usually, that's not a good thing.
Well, when he went back to work, his leg was doing pretty well. But he was climbing stairs, and he didn't have time to elevate his leg. So he went for an x-ray, and the doctor said that the bone was not healing. And he didn't know why, but it was kind of fragmented and frayed. And my husband saw the bone on the x-ray, and he was hysterical. So the doctor said, well, maybe you'll have to have a bone graft, but it's only effective 40% of the time, right? So my husband,
well, 40% of the time it works every time.
Yes, every time.
That's what I hear.
But my husband believed he would be in the 60th percentile, and so he didn't know what to do. So I knew that there was a great chance of him getting an infection in his bone from the compound fracture, and that he could lose his leg. So I decided to set up a program for him to help him use his MindPower to heal.
Now, what was your prescription? Because, of course, you know, you're coming at it from a different point of view here, Dr. Christine.
That's right.
So how did you, what was your prescription for him to heal?
Well, I knew that he had to calm down. Remember, tension delays healing.
Right.
And I felt this cold air coming from his leg when I was standing near him. So I knew I had to warm the leg up. And I made him another audio tape, and he was in a carpool and he couldn't drive.
Right.
So I instructed him to listen to this audio tape back and forth on the way to work. And so he did that. And I also talked to the doctor and asked if he would order because he had this metal rod on the outside of his leg.
Okay.
It was an external fixation device extending from below his knee to his ankle.
Right. Almost like a brace.
Yes, but
Okay.
it's on the outside
Right.
to set the bone and keep it in place. And so I asked the doctor to order electrical stimulation on the outside of his leg, so we could work on the inside and the outside with imagery and also with this stimulation. So that was the mind-body connection.
Right. Now, what was the imagery that you used for your husband?
Well, I took him on a little ride in his mind to a Caribbean cove, and the water was clear blue. And he was in a rowboat, just sitting back and relaxing and rowing out to the middle of the cove. And he applied some sunblock because sunburn was a concern for him, right? And then...
Even in his mind, he didn't want to get a sunburn.
That's right, that's right. And so I brought him into a cave, a small cave. And there he was able to imagine himself in the cave, right? So I'm going to show you.
She's got more things. Were there birds in the cave?
No, there weren't.
No birds, okay.
No, not even bats, I don't think.
Not even bats.
So this is the kind of imagery that I used. So and I have this little hat here. I'll show you in a minute. So he goes into this cave, and he's an engineer, right? And he sees these cracks on the wall. And so his first thought was, I have to fill in these cracks. So now I'm talking to him about what he can do. And in his mind, he had the spackle knife, right? And the spackle. And so I'm instructing him in his mind to start filling in the cracks inside the bone, which became the bone with hypnotic dissociation. So he's filling in the cracks in the cave and inside his bone very meticulously. And then I had him.
Did he have the hat on?
Yes, he had the hat on because he's shining the light on,
have the hat
right?
on.
He has to have the hat on. And then I instructed him to apply these solutions. Here's the healing garden solution. This is an anesthetic.
Right.
This is a cleanser. This is from the pinyon tree. This is an antiseptic. And also, this is beeswax to protect the bone like new skin.
Right.
And he has this little heart-shaped container with little screwdrivers as well. So this is all in his imagination. And he's applying it until all the cracks are filled in. So I brought some of the spackle knife, right? And the
Did you make him wear that hat?
No, it was all imagination.
Because that would be pretty awesome.
But I do show things like this to my client before I bring them into imagery. So here's the little screwdrivers and the paintbrush, right? And also the healing, the beeswax.
The beeswax, right, that you talked about.
And the pinion. So you can imagine that you're applying this, and then he used the light on the hat to set the spackle and also the solutions.
Right. And again, this is all in his own mind.
In his own mind.
Right.
And then, before he exits, I give him positive suggestions, right? Healing suggestions, and telling him that his leg is healed. It's healing and it's healed.
Right.
And that when he recovers, it'll be better than ever.
Right.
It'll be like better than new, right?
Okay. So now what were the results of the imagery and, of course, the hypnosis?
Well, he went to the physician, the doctor, the orthopedist, 3 weeks later, and he had an x-ray. And the doctor looked at the x-ray and he said, "What have you been doing?" The bone was healing perfectly from the inside out.
Wow.
And my husband told him, "Well, my wife made him this recording, and I'm using self-hypnosis." And the doctor said, "I've heard of things like that, healing." And so he was so happy to have participated in the healing of his bone. He didn't need a bone graft, and the doctor was pleased as well.
Right. Wow. That's amazing stuff. And again, that's something that you were able to do using guided imagery.
That's right.
Where
Guided
again,
imagery, self-hypnosis, positive self-talk, the
Right.
things we've been talking about.
and via the recording, right?
Yes, and I made a recording so that he could listen to it twice a day. And he followed my instructions, although at first he thought, "Oh, this isn't going to work. This is crazy." But then he was so scared, and he thought he would calm down at least, right? So it was very successful.
Okay.
And his leg, he said at the end, was better than ever.
That's great. Now, can you tell us what that imagery is? What other imagery is that's useful?
Well, imagery, first of all, there's a great book by Dr. Martin Rossman.
Okay.
And it's called Guided Imagery for Self-Healing. And in this book, he describes imagery as the flow of thoughts that you experience through your senses.
Right.
He says that an image is an inner representation of the thoughts and experiences you have stored in your mind. And he says that the imagery is a window to the inner world of your ideas and your thoughts, your feelings, and your interpretations. And it's the language of the subconscious mind, right? The currency of dreams. And so he says that you can actually use imagery to transform your life and liberate your life, so that you can get rid of the unconscious distortions. And these distortions can really alter your health and also the way you live your life. So he suggests that you use your imagination and use self-imagery to heal.
Right. Now this also sounds like, trying to think, a vision board. Like if you want to achieve something, is it in
Yes.
that? Is it in that?
Yes.
kind
Well,
of thinking?
yes. Because you're projecting into the future, and your mind follows in the direction of your dominant thoughts and your dominant pictures.
Right. So how does the use of the imagery? How does it work?
Well, nobody really knows, I don't think, how exactly it works.
Okay.
Although there's a lot of speculation and research. But when you think about it, you have these pictures in your mind, and as I just said, you follow in the direction of your dominant pictures. And you can literally see the image in your mind, and it becomes part of you. That's the mental rehearsal that we've been talking about. So the imagery can literally help you physiologically. And we know that through some of the work of Dr. Roger Sperry, that the brain thinks, the two hemispheres of the brain think in different ways.
Right.
And that's the conscious and the subconscious mind. So you can use that idea to work with the different hemispheres. So we know that you can work with imagery in areas not governed by the conscious control in the central nervous system, but in the autonomic nervous system, which is more attuned to the right brain, you can literally begin to make changes through the subconscious control.
Right.
And that's done through imagery, metaphors, stories, sounds, and symbols, and also spatial relationships and feelings.
Okay. Now, how does this all translate, especially when it comes to, say, healing from illness or even surgery? Because again, you mentioned, you went through some pretty brutal surgeries yourself.
That's
there,
right,
Dr. Christine.
Well, when you think about feelings, you think, well, that's something psychological, right?
Right.
But when I was at City College, where I received a Bachelor of Nursing, a Science in Nursing, I took a course called Physiological Psychology.
Okay.
And one of the studies discussed was Roger Sperry's split brain procedure. And so feelings are very important to look at when you're using imagery, because emotions are not just psychological,
Right.
They are physiological as well. And they are at the root of all illness and disease.
Now, when they're at the root of the illness and disease, so you're really delving into the mind at that point, and like you mentioned, getting into the unconscious, subconscious. Now, Operation Heal, when you're doing that program, how is that helping with that healing process?
Well, you're looking at it from many different perspectives. We're talking about fear.
Right.
I was fearful. The little girl was fearful. And my husband was fearful.
Right.
What will happen? What if I have this bone graft and it doesn't heal? What if my leg has to be amputated? I mean, that was a big fear. So the idea is that fear prevents healing. And we also, when we're fearful, we go right into that HPA axis that's triggered in the stress response, and we produce cortisol, and that prevents healing. So we have to work towards being able to calm ourselves down.
Right.
And if we have threatening or dangerous thoughts, that's going to really kick in that HPA axis in the stress response. So we need to have very peaceful scenery, something that will trigger relaxation. And with that, we're more apt to heal.
Right. So it's almost like setting the mood.
That's right.
Right? So now, is Operation Heal just for surgery?
No, actually, as I said before, it's a perioperative program for
Again,
people who
that
have
word that I
that's
can't
right,
spell.
before, during, and after surgery.
Right.
So I work with people who have major surgeries or minor surgeries. Also, people who have procedures. Like I work with women who have IVF procedures or other amniocentesis, things like that. So it could be major or minor surgery or procedures.
Right.
But I also work with people who have treatments like chemotherapy or physical therapy. And with this, you can teach them relaxation skills and kind of augment the therapy and the treatment that the doctor gives.
Right. Now, can you describe to us your mind-body program and how that works?
Yes, well, of course. So I have the program Operation Heal, and I have this idea that we can look at it right here on this poster that I brought to a conference recently, and the perioperative nurses there really loved it and said, well, where is this program? This is a good program. So I can describe it to you here. And it works also with people who have longer-term health issues and they want to be well.
Okay.
Right? So over here on this side, you can see it says Mind-Body Healing Methods. And it's about mental preparation and the use of natural healing and rapid recovery, and to visualize outcome before it even happens, right, with a mental rehearsal. And you gain confidence and success in your recovery. And you make the mind-body connection, like I did with my husband, with the external stimulation,
Right.
and then working inside the bone, actually, inside the cave, which turned into the bone.
Right.
And then over here on this side, I have the treatment for healing. So you set goals for health, like I did with the little girl, and you do pre-op mental rehearsal to envision yourself healing rapidly, relaxation skills, self-hypnosis, and then positive self-talk for healing. So that if you say anything negative, you cancel that and substitute positive. And then, of course, there's imagery for physical comfort, which reduces the need for drugs. And here, I have some of the things I work with: general surgeries, procedures for knee injury, back injury, etc. Sports injury is a big thing. In my office, I work with a lot of athletes.
Right.
And also integrative support, right, for chemotherapy, immunotherapy, physical therapy, occupational therapy,
Right.
and the like. So it encompasses everybody's health issues in a way where you can promote healing, take less medication, and it works from the beginning of life all the way to the end of life. I've
Right.
worked with people on comfort care who want to reduce their the drugs so they can do some life review before they pass on,
Right.
or very young people like the 9-year-old.
Yeah, it seems like you kind of cover just about everything. I mean, you've got. Is there anything you haven't tackled yet with this, or you're able to apply this pretty much across
You can
the
apply
board?
this for every health issue, so it's really amazing. And also, as I said, I work with athletes, and you can help them to perform better, to heal faster. And literally, I've had like wrestlers have injuries, they heal, they go to the state championship, and they place. You know, it's really amazing.
Now, what about people with, say, maybe they've got some mental issues that they're dealing with? Are you able to use Operation Heal for something like that, where it's kind of, you know, in the old brain?
Well, there's always an emotional challenge, right, with illness. There's always something, an emotional basis to it, as I said before. So even something simple where, like this little girl should have healed from an appendectomy, and she did physically, and everybody's scratching their head and saying, well, how come she didn't heal? What's wrong with her, right?
Yeah.
Sent her off to this anorexia facility. But she didn't have anorexia. That was one thing.
Right.
She had what I call disordered eating, and it was a result of trauma. So actually, what we did was primary prevention so that she didn't have anorexia in the future.
Right. All right. Well, that's an interesting point that you make. Again, we're talking with our guest, Dr. Christine Silverstein. She is the director at the Summit Center for Ideal Performance, fertilebodyhypnosis.com or idealperformance.net. Those are her two websites. You can also reach her by phone at 201-760-1600. Hey, let me ask you this, Dr. Christine. What kind of advice would you like to leave us, you know, when it comes to self-healing? Because a lot of this, when you're talking about hypnosis and the work that you do, you're not going to doctors, you're not getting, you know, casts put on, you're not getting drugs injected into you. It's about self-healing, right?
That's right. And it's working along with the physician, of course, and the treatment plan. So I'll take a quote from Dr. Martin Rossman, who I mentioned before. He's an MD, and he says that if you choose to have antibiotic or chemotherapy, you should see the drugs coursing through your tissue and destroying the bacteria or destroying the cancer cells that you're getting the treatment for.
Right.
And he says if you're going for surgery, you should imagine yourself healing and perfectly safe and getting through the surgery and promote healing in the surgical area and be aligned with your own body.
Right.
And then he said if you need a treatment of some kind, you should definitely make that treatment your ally and use it in your imagery. So that's basically what I did to help myself to heal. And I've learned over the years, I've had many surgeries and procedures since then, and so I know what to do. So I take this knowledge and I use it to help my clients to use their mind power, and people are grateful for it when they learn what to do,
Right.
and it's a sense of relief. And also, I'm here to share today this knowledge so that people can really feel strength and courage and hope that they can heal on all 4 levels: body, mind, spirit, and emotionally.
Right.
So I invite everyone, all the listeners, to join with me on this healing journey towards wellness.
Yeah, and again, if you do want to reach out to Dr. Christine, she's available either through the phone, which is 201-760-1600. You can also go to her website. She's got a lot of information on them. fertilebodyhypnosis.com, idealperformance.net. Either way, you're going to see her. You're going to see the programs that she offers. You can reach out to her through there as well and contact her privately. Who knows? Maybe she'll
shine
put
a
on,
light.
yeah,
You
maybe
can
she'll
shine
put
a
on the
light on
hat,
it.
and she'll be like, "Hey, can you see me?" Or you'll get a visit from the birds. Either way, make sure you reach out to her, Dr. Christine Silverstein. Once again, thank you so much for joining us. As always,
You're
we
welcome.
appreciate it. And we'll
you.
be back with more on All Business Media TV. Until then, thank you for watching. And Dr. Christine, thank you once again.
You're welcome.
All right.
It was fun.
Yeah.